someone to also ask about their prior experiences with healthcare to know at what level you need to curate your information. Amsi, a question for you. Could you describe the different languages and different tribal groups that exist within the Congolese communities?
Yes, can you hear me?
Yes.
Okay. Yeah, Congo itself, there is 450 tribes. So, and all those tribes, they do have, which we call idiomas, which they are languages they speak. So there is multiple languages which we have. Like in Idaho, we do have those who speak Chifuleru, Kibembe, Kinyarwanda, Kivira, and many others, which I cannot exactly determine all of those.
How would you suggest asking someone the right language for interpretation? You may have information that says this person speaks Swahili. How do you make sure that you are getting adequate comprehension and trust?
To me, which I can say is like, let's say I call a person and I want to exactly understand which type of Swahili he may understand me. I have to ask him, okay, what is exactly your mother tongue or mother language? So from there, I can identify which type of Swahili I will use, or what is exactly the original Swahili will you understand? So that he or she can describe by himself by saying Tanzanian Swahili, Kenyan Swahili, Congo Swahili, because there is different type of Swahili, even if it's Swahili itself, but there is a different Swahilis.
Georgette or Zeze, would you have any other tips for interpretation and challenges that can arise in interpretation?
Yeah, it's very important, that first step of choosing which language is going to be used is the biggest. Once you get the right language, then you have probably 80% of success in that phone call. The best way to help our clients choose the language is not to tell them, do you speak Swahili? The first answer that would come out of their mouth would be yes. However, it's better to use, to ask, what language do you prefer? So we use, then they'll let them tell you what language they prefer to speak. The reason being, someone might be, let's say, 25 years old and left their country when they were young, and they grew up in a different country with a different language, so they don't even speak their mother language. So it's better to ask what language they prefer, or even list all the languages that are spoken in the Congolese community and let them choose.
Mm. So are there other, I guess, how would you interrupt a conversation that's in flow with interpretation to check to see if the interpretation is the one that the person feels comfortable with and is comprehending? How would you recommend doing that?
I think it's to ask the interpreter. The interpreter on that other line understands those differences. And if they can be honest, and most of the time they are not, if they can be honest and say, well, this type of Swahili is different from the Swahili I speak, that would be the first step. The second step is to check with the client as well and see if they are understanding the other person on the other line. Those two questions may help you judge if the conversation is going well.
Yeah, and I also wanted to add something else with the interpreters. A lot of refugees here already know interpreters that they're comfortable with. So when you're making calls to them, they can choose their own interpreters. They know the ones that they understand, the ones that they get along with. So if you use those, the ones that they're comfortable with, you'll most likely be able to get as much information from them as possible.
I think that's really critical, and I would say that in the COVID town halls that we've done, the importance of leaning into locally known individuals to be the messengers came up again and again. So I would agree and repeat what you said, Georgette. Georgette, a follow-up question to you. One of the questions that we had from Central District Health was about accessing people and being mindful of gender dynamics and family dynamics. What advice do you have about scheduling interpreters when you're trying to contact a woman?
I think most of refugees are from like very patriarchal countries where like the male is the head of the family. And as Muzea Misi said that yesterday, he said like in most wives look up to their husbands, and like the husbands have to make the decisions. The husbands are the ones in charge, so they most likely aren't comfortable being in contact with other people outside of their houses without permission from the husbands or without any insight from their husbands. So yesterday we talked about how when you call a woman, you can ask her, is there anybody else in the family that you'd like to include? Or you can ask her, is your husband home? Would you like to be on the call together? Try maybe to ask them what time they would be at home, where they'll be comfortable to talk maybe with anyone who they want present. So just make sure that they know they don't have to be on that call on their own. And we also talked about the importance of like spaces, because sometimes you just call out of nowhere, maybe, and like maybe somebody might be in Winco at the grocery store. They might be busy at work, and that's not a convenient time. So make the appointment with them ahead of time and give them that choice.
I think in both of those pieces of feedback, there is the encouraging of the power of the individual, right? So a woman can choose, nope, I want this to be private. It's my personal medical information and I want to do this alone. Or, you know, actually, I'm not going to do anything without my family member, whoever that may that I choose and I identify I want in this call with me.
Right.
Can I add something,
Please.
Julianne? It is also important to look at the family as a family unit. I mean, these refugees, they've survived together. There is the bond that they have with, if one is going through hard times, it's better for other family members to know about it. Of course, per the permission of the patient. But I would encourage that to happen, because you might even have an adult child who is running the entire family. Then you are giving instructions to someone who doesn't even have power within the family to make sure that every member of the family is following the instructions that were given. So I would say that if the patient approves it, please try to include other adults in the household.
What advice do any of the three of you have to establish trust? I mean, it's a really difficult thing to say, I'm calling someone and we're going to ask all of these pieces of intimate information specific to your community. What would help someone establish trust?
Something that I would talk about first is like the CDH. I didn't really know anything about them until now. So that means I'm not the only one. A lot of refugees refugees haven't heard of the CDH. So when they just receive that phone call, like I'm from the CDH and like I'm trying to get this and this, it's not very likely that people will just open up and share. So something that I can encourage is using community leaders. For example, maybe a group, a family within a church, contact their pastor. They might be able to help you reach them, and they might be able to open up through their pastors. Or also, like we talked earlier, using local interpreters, because they know those people. And maybe when you call them, don't go straight to, oh, you were tested positive and now I want to ask you this. Like, establish like a personal connection first.
And I would add that, I mean, the video was great, Julianne and everyone that was involved in that. Sending, because it's a general video, sending that video to all the pastors and other community members so that you can make sure that people understand what public health, Central Public Health is doing. That will be the first step. The second step is to provide alternatives, as you call these refugees, to give them instructions about social distancing, for example. Make sure that you understand that, I mean, I'm from the Congo. I know how difficult that is to not go and visit a friend and talk. And the reason that is because during many years of exile, we didn't have any other activity in the refugee camp. No school, nothing, no work. The only thing that put us together was social events, meeting with each other and talk. Now, all of a sudden, we are asked not to do that because of this, and without giving us any alternative, especially when we are telling them you have to stay at home 14 days or 10 days and no medication. So they feel like they are abandoned. If this disease is very serious, why should I stay at home? So spending a lot of time to explain exactly what this is, why this is. It's not like in a black and white type of script that you're reading. Make it as a conversational as possible so they feel like you're invested in their lives and the lives of the community.
I think I'm going to build off that question and invite Amsi or Georgette to speak to this. I know in my work in the resettlement agency, I've learned that as Americans, we tend to operate within a cultural context where we cut straight to business. Even this meeting, we open, we show the video, we start talking at you, right? That is not how many refugee cultures function. There's a whole lot of kind of social connectivity developed before you get to talking about something serious, and especially talking about anything private. What advice do you have? What recommendations do you have about how you build that fabric of trust in order to get people's confidence to share? There were some things that came up in our prep call, but I'm going to open it up to see what comes out now.
I would say, like, at the beginning, like maybe when you get to somebody's house or when you make a phone call, like try asking them how they are, how they've been doing, how are the kids, just like simple questions like that before jumping into anything so serious. And also just be aware that you're not maybe accusing them or making it feel like it's their fault that they're sick and anything like that. I think that also can be something that I think we talked about, people just being afraid of stigmatized and like being discriminated because of their having tested positive. And I think somebody mentioned earlier, just showing that everything will be confidential and that their information will not be out there.
If I can come back first on explaining about how the refugees families are built up. Many of us, we do have the extended and large families. That is how the African community we are. We have the extended families. So on social distances, it's very rare, as my brother there mentioned, just from where we come from, also passing by the refugee camps, We always have families, relatives in big, large numbers being together always. So it's something which we have to understand that even if with this disease coming, it's not something which we can change overnight. Okay, just keep distance and to separate these people for not doing what they have been doing all along. Okay, by getting into the conversation with them, I know what I can mention there is, let's understand the refugees. The refugees are people who just comes, many of us, including myself, I think I have trauma with me. Um, but, so it's depend on how you can introduce yourself to me, how you came to me. So come in the manner, in the way that like something you comes with soft language, friendness. Those simple questions, simple conversations, then you can enter into your message, and that I think it can be better. And when you deliver the message, in case of these diseases, don't just deliver a message and stop it there. Please keep repeating it again and again, several times. That can be my advice.
Can I
There's
add to that, Julianne? I mean, trust is everything in communicating with the refugees, and when you don't trust, when they don't trust you, then anything you tell them, it's not gonna go anywhere. It would enter from one ear and it would go out from the other one. I remember when I was receiving threats, and some of them were racial 2 years ago. And after someone makes me uncomfortable, and then they ask me, can you come and speak to our group about the refugees? So, and I would say, yes, I would talk to my boss and say, okay, I want to go and talk to this group. Then my boss would tell me, no, don't go there. Then I would give him 2 reasons why I want to go there. One is just because I feel like those people need to be educated. 2, I've joked with my boss saying that I've dodged hundreds of bullets, so this is not one is not gonna kill me. Mm-hmm. So what I'm trying to say is, the refugees, when they go to different clinics, there are certain things that hurt them, that they feel like they are not treated like other patients, and then when you're calling them about something important like this, they don't have any trust for some of our clinics already. So what is important for you is when you call them, keep that in mind. I mean, it's the reality of life that we live in. And it could be only one clinic or one person at the clinic that made this refugee not trusting the healthcare system. But do your best. Make sure that you're talking to them with respect, especially listen to them, what they want. And then don't just jump on other issues when there is an issue or a question that they've asked that you're not able to answer. Please, what I would say is speak with care, with respect as you talk to them, and that may help the trust a little bit.
Yeah, and something else I wanted to add with that was that, like like something that I've thought about before and said is that refugees won't tell you if they feel uncomfortable or they don't want to talk to you. They will most likely just stay there and give you like the most basic answers just to be done with everything, you know, because they already, the way you approach them, maybe you made them feel uncomfortable, so they won't tell you what they're feeling. They'll just answer as much as they can with as little, like few words as they can, and then get it over with. So how you approach them and how you start the conversation, like Zeza said, it matters, and that's what will determine how much information and how accurate the information you'll get from them will be.
Um,
Go ahead, Amsi.
okay, I would like maybe also to say this. On top of that, don't take me wrong. Remember, the refugees, what I can say is do not lose your subject, because if I spend 18, 20 years in the refugee camp, receiving almost everything free, doesn't matter whatever you're bringing me, the serious message, whatever, I expect something free from you. So I thought you may bring me the serious message, but I can always take you in the wrong way according to my expectations, which they always sometimes wrong. Oh, okay, I have Juliana visit my house. Oh, I have a call from this such person. Maybe I'm gonna get something from there. So my conversation may lead you in the wrong way, but reason why I'm saying try to keep your subject in mind. Even if you're gonna start with joke, you're gonna start with respect or whatever, do not lose the subject that you have to him or to her.
I think, Zeze, what you brought up about kind of legacies of trauma and racism are really true. I want to come back to that in a second, and I want to pull out something that you mentioned when we spoke before about empathy and that in the role of trust building. This disease is a little bit strange in that the regimen recommended for treatment might feel like non-treatment, right? Could you talk a little bit about that and about how a person could be asking, questions about someone's well-being and giving advice for how to get through their experience of the disease in a way that doesn't feel like they've just been written off?
I mean, in people's minds, and not only refugees, by the way, when you have this label, they labeled you that you have a virus. What you're expecting is treatment. What you're expecting is vaccine. What you're expecting is someone to help you go through that. Now, it's no one's fault. I'm not saying it's no one's fault, but what is happening is when they are telling you stay at home for 14 days, then you can't socialize with other people, you can't work. And now you start thinking about, now my family's in danger. I mean, if I got this virus from work, then they're telling me to isolate myself in my house. I have the most precious people in my home that I will live with for the 14 days. Then I'm worried about all of that. So I think as we communicate the information to the refugees during that moment of instructing them about the things they need to do to avoid spreading the disease, you have to be careful, because you're telling them, okay, spread the disease only on your family. So you have to make sure that you spend a lot of time to explain why there's not any medicine. Explain why there's not any vaccine for it, and explain why they have to stay at home and make sure they understand it. And then refugees, I would say that refugees learn by repetition. Don't think if you tell them one time, don't think that they got what you said.
And like something else with that, on top of repetition, is also personalizing it. So repeat it a lot and make it specific to their family, how it will impact them and their health and their lives and their kids. Like give some personal stories, some real life examples that they can see that this is really going on and these are the impacts and this is how it's affecting people. So it should not seem like some kind of movie or something like that's fiction.
So having asked some questions at the beginning that establish some rapport, you know, how are your kids doing staying home from school? How are your kids feeling? That might be a platform that you could then add advice questions onto later.
Right.
I'm wanting to have good Q&A time, but I do also want to reference that our national landscape and our national conversation around race has become very intense right now, and really present in a lot of other conversations. Is there any advice that you would give about how community members are feeling about what's happening nationally and how that translates into trust in healthcare situations?
Obviously, what's going on today nationwide, it's affecting many refugees, the way they think about government, the way they think about our police forces, the way they think about basically all government services. First of all, the community has suffered for a long time to the point where you have to be kicked out of your country, and most of the time the government is involved in all of that. So you don't trust the police, you don't trust the government services, and then you come here with hope that this is the country of opportunities, this is the country of everyone. And many refugees think racism has gone. I mean, there's laws that control racism. So you think that now I'm in a better place, and something like what's going on happens. Your morale goes down, and really the trust of seeking help from the government or even interacting with the government goes low. So that's what is going on. I mean, it's something that touches refugees even deeper on that. Some of the conflicts were tribalism, where a group of people wants to control others or kill others, and the same thing is in this case race is happening. So they have had very severe consequences of tribalism, if they can, compare it as racism that is happening here. And if there's a fear, for sure, there's fear that then tomorrow it could be me.
Maybe what I can also suggest there, and what I can say is, the nurses who will be calling, they have to have this in mind. We're talking with people which we call refugees. According to me, I can say is the racism, it's even in the healthy program. Because if I went to the hospital, as I says, African community, we raised by somebody have to lead someone. I've grown up with that instructions. So my family gave me the whole trust that this person, if he says something, this is the good things can lead us. So with the sickness of someone from my family members, they trust the leader, they trust the head of the family. It doesn't matter she is a single mom, they trust the mom. If his uncle who is leading the family, they trust the uncle. So that particular person go to the hospital and now, okay, doctor, I have like, okay, we want only to see her, we don't want to see you. We're gonna ask her some questions and you can just remain there. Okay, they do that to me, but the next person, okay, they come, two of them, and they go, they was been attended, both of them, but I know the wife, she's the one patient, and the husband just holding the wife on the hand, they both goes into the same room with doctor. At the same time, I feel kind of like, so there is a, why they ignore me, I cannot go with my wife and that other persons just because is white. So what I can say, those are the things which we feel like we are really discriminated. Sometimes we have been asked like, okay, how many kids do you have? I have 7 kids. Wow. So you start, okay, I don't know how you feel. So I feel kind of like, did I do wrong by having my 7 kids? Okay, and some questions also keep coming like, how do you support all these kids? Okay, where I came from, I didn't ask myself those questions, and I haven't having any problem by having them. So you asking me those questions, you minimize me. I feel uncomfortable with all those questions. So if they can provide some other type of conversations which they can make these people do not feel like they're not treated equal.
Right, and I think he's there. He's just calling for like cultural sensitivity. Like the way I said before, like refugees won't tell you when you're making them uncomfortable or when they feel you've been racist towards them or biased or just judging them before knowing all their stories. So they will not share that with you. So it's up to you guys to just be like really aware of the things that you're saying and watching your words and just making sure that you're not making them uncomfortable with the way that you come across towards them in everything that you're saying. And something else that they've been saying, this whole situation with George Floyd and the protests is that a lot of refugees have been reflecting on their experiences with racism here in America, because that's not something they expected when they came here, but it's something that they've been facing since they got here. So this experience really, I've talked to a lot of people who now I like saying, oh yeah, like this one time I went to the hospital and like they made me wait for maybe like 45 minutes and then canceled my appointment. And because I came late, but they weren't communicating with me. Like a mom told me about how she went to the hospital once with her child, and the doctors told her, oh, this child is not really sick, you can go back home. And then a couple of days later she came back, and then the doctors were like, why didn't you bring this child in the hospital? Now they're so sick, like they were supposed to go to the emergency room, you shouldn't have brought them here. So they feel very neglected and stuff like that. And I think now they are seeing they're no longer trusting the government and stuff like that. So we just have to be very aware of that and careful in the approach.
And mindful that there are histories of interactions that you can't see that might have, created perceptions or distrust. There's one last question I want to hit before I open up for questions. I realize we're getting close to the end of time. We've talked a little bit, and Zeze, I'm just going to use your quote from earlier. You said, I've dodged lots of bullets. This is easy, right? And some some refugee families have this attitude towards COVID-19, right? This seems very mild compared to everything we've survived, whether it's war, HIV, Ebola, malaria, you name it. What advice would you give to help people communicating with refugee families understand that, you know, while symptoms might be mild, there are very big weights of public health concerns? How would you advise folks to communicate that?
I would say that it's to start with how around the response of governments around the world. That itself shows that it's very serious when governments of multiple countries, if not all, close their economy just because they believe this is a very serious virus. And also talking to them about the consequences of not following the instructions you're given. I mean, talk about the numbers. I mean, the numbers in our state compared to the population of our state, it's scary. And also talk to them about the spread, how this is spreading so fast. I mean, you may have only one person, and then how many can get the virus just because one had it. So, and also talk to them about this is the time to protect their family and their community, because they dodged bullets, they lived in horrible life, but they didn't have any control. Now they're empowering them so they can control what happens with their family, with their community. So it's very important to empower them that way, that before, things that you had to go through, you didn't have any control, but now you do have a control, and this is the instruction.
Remember, some of them, they do feel like they feel neglected when they are mentioned or being known in the community that they do have the virus, let's say HIV or the COVID-19. So they don't want to be known in the community that they have those viruses. Otherwise, people, they're going to be kind of like neglecting them or laughing on them. So by that, I think it's better if we can reach them, if it's possible physically, or also to keep reminding them about the consequences that they can get by getting in many people. But we have to understand also the COVID-19 virus is very different about the HIV virus. So the COVID-19 is some of the virus which they spread very fast, and they can affect many people. So it's better also we have that encouragement of telling them, reminding them many or several times.
All right. I'd like to share with all our audience members that we're taking both the comments from this panel and then any answers to your questions and producing a written document for you to have for later reference. With that, what questions do you have? Have you had any particular conversations or circumstances that flummoxed you that you want to know how could we respond in this situation? We'd love to hear from you. If I were in the room with you, I might make you stand and wiggle to get some energy in the room.
I think this has been incredibly helpful so far, but does anyone have any questions?
I just have a comment on that, because we've been working with several families, and I have seen a lot of the comments and things that you've mentioned today, so I appreciate it very much.
Thank you.
I have a question about working with the translator. So when we're asking the individual who's a confirmed case a question, should we be asking the translator like, hey, will you ask them this, or should we just be speaking directly to the case? Because I saw in the cultural competency training, it said to speak directly to them, but I know when I was interviewing a Swahili speaking individual, I was referring to the translator more than that individual.
I would say that I mean, when you're using an interpreter, your job doubles. You have to ensure that the client understands, and you have also to ensure that the interpreter understands what you're saying. So for me, I would suggest that you focus on both the patient and the interpreter.
Could you give a little more description as to how?
It would be maybe asking the interpreter to paraphrase what you said. If it's very, very important and you want the message to be transmitted the way you want it, ensure the interpreter tells you, say it back to you in English, so you understand that they understood before they can transmit the information to the refugee.
I would add, generally common practice is to speak directly to the case or the patient or the person and not to the interpreter, as that does kind of alter the dynamic of the conversation. I would say that a really common way to check comprehension that can land you in trouble is asking, do you understand? Invariably, the answer will be yes. So try to ask more open-ended questions that require the person that you're talking to actually repeat back to you what they heard. That's a much better test of comprehension than asking, do you understand? Other recommendations for working with interpreters, Amsi or Georgette?
I think I agree with Zeze, what he said. I think you should focus on both, because like also like something with eye contact, like a lot of refugee cultures, like eye contact is not something that we are comfortable with or like grew up with. So like they don't want to be looked at like the whole time you're speaking to them. So focus on both. Just I think you should focus on both, and like sometimes you can watch their reactions to see if they're understanding, because like with nodding and those just gestures that they're doing, you can tell.
I would layer on to that, if you can use WhatsApp to do video calls instead of straight audio calls, I think you'd have much greater success, both of people answering and getting trust within the conversation. When people can see you and see that you're genuinely expressing concern and support and emoting, I think you'll have much better communication results.
And I heard the question is like, if he wants to deliver the message of somebody who is positive, am I correct?
Yeah, I had to deliver that message in a couple cases, but I guess I was more or less asking how to, use the dynamic with the translator or interpreter, as well as the individual who's the confirmed case. Just how to balance that dynamic, which it sounds like using both is probably the best technique.
Yeah, my much concern is, as I mentioned before, the confidentiality. It's very important. I know it's part of the interpretations rules, which they have to be confident on any message or any information that they're delivering. My concern is the feeling of that person who is going to receive that information. So we have, as they mentioned, we have to make sure that he is comfortable to receive that result, so that there cannot be any panic, because some of them, by receiving those results, we don't know where he or she is, around her, who's there, and what can be the emotional reactions. So the reason why I said we have to find those before we deliver that message, and to make sure he is willing or is aware to receive any of the results, to be positive or negative. We have to make sure that person is aware, and he is willing or she is willing to receive that result.
So there's kind of some preparatory conversation before delivering a result. What?
Yeah, well, I was going to say that you may call someone and the person is busy with other things, and they don't have time to sit down and listen. I mean, right now in this emergency situation where we want them to get the information as soon as possible, as fast as possible, then if you're giving the information without expecting that phone call, then they may be somewhere and they may listen to you. You may think they've heard you, but not. So one of the suggestion that I'm giving is maybe when you send that video to before you call them, and try to schedule an appointment for that phone call, so that they know they have to take time off everything to just focus on it.
And for scheduling, you know, we understand it's hard to get refugees to pick up the phone because they don't know your number and they screen calls just the way everyone else does. I highly recommend texting through WhatsApp. You know, we'd like to have a conversation with you. When are you available? Do you think that texting in English is feasible? Do you think it would be better if we offered some basic phrases like, when are you available, in Swahili or other languages? Or do you think, you know, a basic, you know, when can we talk in English is going to be understood by most people?
I think you should use like their languages. Maybe if it's Swahili, use like a Swahili interpreter and send like a voice messages. Mostly I feel like refugees like listening to voice messages than reading the messages. So just a simple like 30 seconds, hi, this is who I am. I need to talk to you about this. Please let me know when you're available and we'll call you back. I think that's more like a good idea. That works.
Yeah, I do agree with Soka about the voice. If they use WhatsApp app, please, it's better to use a voice rather than sending just a message. And even if they send it in English, make sure they mention the issue, the words, find interpreter, because if they receive a voice message and they listen that, they can even ask somebody to just translate that short message to them, and they will be able to have a time and to find you. Even they might find the interpreter by themselves, one of the family members or somebody they trust, and okay, there's somebody want to talk to me here, please speak English and be with me here so that I can understand what they want. That will be the best way, according to me, rather than writing a message.
I'm going to open it back up to the room.
Can I make one comment on
yes.
that? Just quick one. The majority of the Congolese, I would say, they don't read and write. It's very important if you send that message, it's a voice. That's just a comment that I wanted to add.
Heard, definitely heard. A question back to the room. What do you think you need from us? What can we help you with? Are the suggestions that we've put forward ones that are actionable? Are there barriers or problems with what we've put forward that you would like to talk through? What else can we do to help?
So far, I think this has answered a lot of our questions and will be helpful. I think we'll convene as a group and determine if there's more we need. And I think with some trial and error, we'll figure out what works and what doesn't within our interviews and calls. So did you want me to compile questions and send them over if we have additional ones?
That would be really helpful, and we will answer them all in the written document.
Awesome. I really appreciate all of your time today.
You're very welcome. Thank you for the opportunity to be able to meet with you. This is a real gift.
Thank you, Lindsay.
You're welcome.
And thank you all the panelists. It was fabulous. I learned also.
You're welcome.
All right, everybody have a good rest of your day, and really appreciate your openness to listening to the ideas put forward, and looking forward to working together in future.
Thank you.
Thank you.
Thank you.
Thanks, everyone.